My name is Melissa Jones. I'm the Executive Director of BARHII and our new partners, Rise Together. We are hosting this meeting today and really glad to have you here to talk in particular about COVID-19 response and our overall policy platform for the year. This moment is actually the kind of moment that is at the heart of the merger that we went through earlier this year, where the fundamental issue around health and safety and health equity is intersecting very clearly with economic impact that can have long-standing health impacts and economic impacts for families across the Bay Area. And so I want to thank you all for joining us today, for the ongoing conversation that we've been in with you.
You just gotta wait for the waffle.
For the ongoing conversation we've had with you over the last few weeks, as we've heard from different partners about key priorities to move forward. And Asma Day on our team has done a lot of work with the other team members to put together something very focused for you today on COVID-19 response and to continue the deep follow-up all staff have been doing on our content policy areas. So I'm going to pass it to Asma, who's been doing a lot of work to help us think about COVID-19 response, has talked to many of you, as have several other folks from the team, and put together an overview of the beginnings of what could be a policy and messaging platform that could be a response for the region that promotes health equity and economic security right now. So thank you all for being here.
Great, thank you, Melissa. Good morning, everyone. As Melissa said, I'm leading this effort to kind of convene the group and strategize around COVID-19 responses in the region. Thanks to the BARHII team for helping me pull this together. Thanks to all the speakers who are on the line today who are going to be contributing immensely to this conversation. We have a lot to get through in 45 minutes, and so I'm going to try and be as fast as possible with my talking points, because I know we have some speakers on the line who are going to help us walk through some of these issues as well. So to start, I'm going to try and share my screen with you all. Let's see if this works. Okay. So a quick overview of today's discussion. This all began when we heard from our policy committee the need to come together as a coalition to discuss response efforts in the region and to do so in an equitable manner. We know that there are a lot of vulnerable populations out there right now who are really bearing the brunt of what is happening. And we want to try and collaborate our efforts so that we're not reinventing the wheel, but that we are contributing to this effort in an additive manner. And so we came up with a response policy and actions slate. It is a document that will be shared out with everyone. It's complete as of today, and all the updates on the slate are as of yesterday, 5 p.m. What the slate includes are both recommendations that came out of our policy call that happened this past Wednesday from the different counties that are working on several policy areas and the thinking around strategizing on what's to come next, in addition to some fluid research that's been happening on our end as the BARHII team. And so the goals of this slate are twofold. One, we want to support our member local health departments and community partners with providing immediate relief to the families and small businesses impacted the most amidst this crisis. And secondly, to use this moment in time to really bolster our equity and resilience efforts and to capitalize on the creativity and capacity that we're seeing really coming out of the woodworks in a lot of these efforts. And how do we use that as a long-term impact for these areas? And so again, the process was listening in on that community meeting that a lot of you on the phone today were actually a part of, in addition to some research. And again, we will share this at the end of this meeting today. And so for a quick overview of the impact areas, these are the key themes that we heard from our members and partners around the most vulnerable populations and impact areas that we should be focusing our response efforts on. So firstly, housing stability issues, financial assistance to families, and that comes in the immediate form of things like cash assistance, economic security for small businesses and gig workers, early childhood support issues, and a new emergent area that came out of Alameda County, which is equity issues around law enforcement. Some adjacent areas that weren't really key focus areas, but we thought were important to lift up are things that are happening around healthcare and frontline service response, as well as food security efforts in the region as well. And then we would love to touch on some messaging considerations. This is really important in this time as you all are sending out messaging to your community members and partners. How do we do so equitably? How do we make sure that our messaging is effective and solicits fast response as well? So to start, for our housing stability, and again, just to backtrack a little bit, for each of these areas, we really broke down the policy issues by magnitude or amount of reach. So we looked at local efforts happening at the county level, we looked at statewide efforts that are happening, we also looked at federal efforts, and for the sake of time, I'm not including the federal policies that have been passed in this document, as I'm sure it's widely spread, and it'll still be available in our slate if you're interested. And so I'll just lift up kind of the most pertinent things that are happening. So for local efforts, we heard from Alameda, San Francisco, Contra Costa, and San Mateo counties that there's a really all hands on deck effort to look at eviction, foreclosure, rent increase, and power shutoff moratoriums. And there's also been a statewide effort to do so, although I will loop in TC here to talk about Housing Now and what they've been doing around the response for the around the governor's what they called a really disappointing eviction quote moratorium, not quite a moratorium, that really devolved to local authority when they indeed had the authority to do something much more impactful. So TC, if you'd like to say one word about that, and then after you speak, I will also introduce Ian Winters with us on the phone, who will give us a little bit around the efforts that he's working on as well.
Hi, everybody. This is TC with BARHII. We are part of the Housing Now work on sort of responding to the governor's sort of executive order on eviction moratorium. The analysis from sort of housing groups that include Housing Now, and I think a lot of on the ground, I think this is probably trickling up to everybody, is a twofold concern. One is the actual policy itself, which is very disappointingly incomplete and is just a encouragement for cities and municipalities to pass eviction moratoriums, and the type of eviction moratoriums that would be passed would be ones where, you know, people have to prove that they cannot pay their rent because of COVID-19. So it's kind of having to prove a negative, which is incredibly difficult, but incredibly easy to dispute. And also sort of in order to do that, that allows for evictions to actually be filed, and people would actually need to go to court of violating the shelter-in-place order in order to sort of dispute and advocate for why they are qualified for the moratorium. The other concern that advocates have is that this is a worry that this would be the ceiling of what should happen as opposed to the floor. And that we know that there are a lot of different municipalities who are thinking more expansively. The group is sending out a sign-on letter of, at this point, well over 90 organizations from across the state that include BARHII, but like also include tenant rights groups, organizing groups, things like that. And they are looking to have an ongoing campaign as well. And a small group of us who were kind of a working committee of the housing equity table are also sort of thinking about what is the media strategy around that. And that's the second point, the second concern, which is there's been a lot of erroneous reporting that what Governor Newsom has proposed is an actual eviction moratorium, and the reporting around that has been really problematic. So that is kind of what is the concerns, and what we would encourage people to do, is to support the Housing Now work, and as future sign-on letters go out, we'll share that and encourage you to all sign on as you can. The other thing that we need at BARHII, which would be great, especially for the health departments and health groups, is whatever kind of information you have, whether that be research, data, anecdotes, stories, narratives around the connection of public health and housing as it relates to coronavirus, that would be very important for us as we are putting together our own statements. Thank you.
Thank you so much, CC. And now, Ian, are you still with us?
Yep,
Oh.
I am still here.
Okay, great. I'll introduce you shortly, but please take it from me after. So Ian is with us from the Northern California Land Trust. He's the executive director and has been leading a lot of the efforts around responding to the housing issues in the midst of coronavirus response. And so Ian, if you'd like to touch on a little bit of what you have been working on, what feels pertinent in the region, and what are some recommendations for folks to support your work in this group. Thank you.
Sure. So Asma, thanks, and Melissa and everyone, thanks so much for having us. And also just want to say, you know, we are frontline housing providers. We are not policy experts that are connected at every single level of government. So, you know, please forgive us if we get some things not quite right. And I also want to have my colleague Sarah, who is our policy director, chime in as far as like what we know as far as a rundown of local efforts.
Yeah. Should I start, Ian, or you?
I'll take 2 minutes and then hand it over.
Yeah.
So my part of the work for the last 10 days or so has really been focused on emergency housing assistance and how can we as a region come together and not see this turn into a housing crisis, that the fallout from this is not a housing crisis that makes what we have right now look like a sort of kindergarten version. Because our fear in doing surveys of our residents, and I'm also on the head of the California Community Land Trust Network in talking to other community land trusts, that an eviction moratorium and a foreclosure moratorium, assuming they really go into place broadly, as TC talked eloquently about, it's just pushing the crisis back. It's not resolving it. And so we really, the scale of need that we have to provide people with emergency housing assistance really broadly in ways that are not intended to disprove and disallow assistance, but are intended to allow assistance is huge. You know, our portfolio numbers, you know, they're sort of back of the envelope, but we've canvassed all of our residents, and we're looking at around 40% of our residents have lost or expect to lose 100% of their income, with very, very little supplementary income actually coming through to them. So in terms of actual assistance, what we're trying to do is we've been pulling together a working group, which a bunch of you were generous enough to be on that call yesterday, of people from the philanthropic sector and the housing sector and the policy sector. So BARHII, EBHO, the CLT world, other rental housing providers, and the philanthropic world, Catholic Charities, a few other groups, to see how can we rapidly scale the emergency housing programs that we have in a thoughtful way that can hopefully be extended, at least for us, you know, across Alameda County. But it would be great to have a thought through program working regionally, where instead of sending people to small organization after small organization looking for little bits of money, we can say, here's, you know, you can show that you've lost X amount of money, you know, 50% of your income, and you are now housing burdened. Here's 2 months worth of help. So that's kind of the synopsis of that. And Sarah, do you want to chime in on the policy things?
Yeah, and TC, thanks for laying out what the state has failed to do, because when I go through what I've pulled together from partners very quickly on what's been done on the local level, it's all over the place. And so everybody still needs to push as much as possible on the state level because it would help a lot. So I'm going to go briefly through counties and then cities. And again, stuff is changing very quickly. So I may be missing some stuff. So others can chime in if you know more than I do. Alameda County and Contra Costa County, as of March 15th, have paused their eviction trials and settlements. I know for 3 weeks in Alameda County, I'm guessing it's the same in Contra Costa County. In San Francisco County, it's very confusing. The San Francisco Sheriff's Office has said that it would postpone evictions for 3 weeks, but there were eviction cases that happened on Monday, and then organizations that received filings for more evictions on Tuesday and Wednesday. As far as moratoriums or limitations on evictions, thing with San Francisco, it looks like commercial evictions, new ones, and residential evictions connected with COVID-19 have been halted for 30 days. And then what I know most intimately is Berkeley. So again, there's been a moratorium that's been put into effect for evictions, people that have evictions connected to coronavirus. And that is in effect not for a certain amount of time, but until the local state of emergency ends. And they have also put together information. Tenants will be required to repay rent, but the city is putting together regulations for how tenants will have to repay back rent, so they won't be required to pay all of it at once. And then the city is also authorizing the city manager to set up an emergency fund for rental payments. We're hearing it's around $1 million, but not exactly sure what that'll look like and when it'll get out. And there's been no mention of restrictions on foreclosures and defaults, although it tentatively sounds like they'll add that to a future meeting, possibly next week. And that's the only area that I've heard, local area I've heard talking about restrictions on foreclosures and defaults, which is a big deal. Those need to happen. Vallejo, as of March 17th, there's a limit on residential and commercial evictions. That's also in place until the termination of the state of emergency. I also believe those are evictions connected to loss of income due to COVID-19. Same thing in San Francisco. It's unclear to me how long their eviction moratorium is in place, whether it is until the end of the state of emergency or if it is actually just 30 days. Let's see what else here. And then, you know, there are legal assistance providers that are trying to push for an eviction moratorium in Hayward. I haven't heard anything about Richmond and El Cerrito on the local level, but everybody's trying to work on so many different levels at once, and it's confusing for people locally to have to do all of this while they're also facing crisis, and then for us that work across different cities and maybe even different counties, it's a lot to be dealing with all at once.
Thank you so much, Sarah. Thank you both, Ian and Sarah, for those updates. Those are great. Thank you. Okay, our next area of focus that we looked at is financial stability for families, and we heard a lot of interest around getting fast and quick cash to families that need it right now in the face of losing their wages, in the face of having children to care for. And so we heard from Alameda and San Mateo that there's some neighborhood stabilization efforts through mortgage and rent assistance for families. There's some paid sick leave extensions that are being looked into. And then a bit of a statewide effort. And I think we have Sasha with us on the line, but I will ask. Sasha, are you with us? Maybe not, and that's okay. So Sasha is the Economic Justice Policy Manager, and she has been managing this effort as part of her coalition with the California Immigrant Policy Center to ask the state for immediate release of family funds, which include the young child tax credits, and including ITINs in the CalEITC credits. We know that the tax deadline has been pushed back in light of COVID-19, and so there's more of a chance for the coalition and anyone else who's interested in joining her efforts to push for this. This will guarantee kind of immediate cash in families' hands once this is passed. And the ask or the call for this is to have it retrofitted for the tax year 2019 so that it's a simple amendment on the families and if they want to be included in that. But hopefully Sasha will join us soon and she can speak more to that. If not, we also have more resources on this and her contact information if anyone is interested in this as well. So we'll move on. Yes.
Since we have a minute while we're waiting for her, can we ask if people want to add to anything that was said in the housing piece? Because we've heard from a lot of the partners, both from Rise Together and from BARHII, about the importance of housing stability right now.
Sure, we can absolutely open it up. Does anyone have questions related to housing or anything that TC, Ian, or Sarah shared?
Or additional thoughts?
Or if you don't see your county represented on this slide and we didn't get a chance to talk to you over the policy committee meeting, if you want to share any updates from your county.
This is Heather Henry from Solano. Can you hear me?
Yes, we can hear you, Heather.
We can.
So one thing that I just want to share, I think I'm the only workforce representative on the call, but throughout all of California and the Bay Area specifically, we are shifting a lot of our workforce services to those that are laid off and expanding supportive service pieces. So as it relates to housing stability or food stability or any of those pieces, I highly encourage people to connect with their workforce board because we're getting more money from the state and the state's requesting funds from the feds in order to be able to expand those pieces. There was over 200,000 people yesterday alone that applied for unemployment insurance. So we're furiously trying to provide these supports, and it does include financial supports for these pieces.
Excellent, thank you, Heather.
Thank you.
That number again, was that 2 million people?
200,000 yesterday alone.
Okay, thank you.
In the whole state or in your area?
Oh, no, not in our area. To be honest, I mean, all this information is coming at us fast and furious. I'm not sure if that's state or national, but I do know that unemployment insurance in our state has gotten more requests in the past 2 days than they have all last month.
Great, and we're going to get into some income support too, I think, in the next piece. Maybe we can talk more about it. Yeah. Anything else on housing?
This is Ian again, very briefly. I'd just say we're already, to kind of highlight, we're anecdotally hearing from our residents and families that a lot of people are starting to run out of food money and need food assistance.
So this is TC, just since we have a tiny bit of time, and I saw somebody in the chat wanted to hear about sort of what's happening at the federal level. We are connected to two federal sort of coalitions. One is the Coalition for Human Needs, which focuses on public benefits, and the other is the National Low-Income Housing Coalition. And you may have heard of it, but basically Congress has passed the Families First Coronavirus Response Act. That sort of expands USDA food assistance and nutrition programs, especially for young children and for the elderly, and suspending work requirements for SNAP assistance. The other piece of that is it establishes a federal emergency paid benefits leave program to provide payments to employees taking unpaid leave due to coronavirus. outbreak, and expanding unemployment benefits. One of the concerns advocates have in DC, and I think reflected in our concerns, is there's nothing in that sort of legislation to address any of the housing concerns, nothing around rental assistance or cash assistance for housing, and nothing around eviction moratoriums as well. So I just wanted to give a quick update on that, just to let people know what's happening at the federal level. It is on President Trump's desk to be signed, and everybody is saying that since it passed the Senate, he is likely to be signing it and will be enacted within the next week or so.
Great, thank you, TC. That's also going to be included in our slate, so people can follow that. And I see that Tram sent in her question, so we'll take her question and then we'll move to our next topic. And again, we'll open it up to Q&A at the end. So Tram's question to everyone is, does anyone know if counties have the authority to extend moratorium countywide? Our county council is asking.
Yes, of course they do. Under local health officer authority. Yeah, I mean, there's no set time window. You know, so our county, for example, will reevaluate, but I think we'll reevaluate in the backdrop that there's now a statewide order. And so if we tweak our order or extend it, it'll be in the context of examining what the state ordered has or hasn't done to enable us.
Are you speaking about
And Dan,
the shelter in place or the eviction moratorium?
Oh, I thought you were talking about shelter in place. I'm sorry.
Yeah, I think you're talking about the
My
eviction
apologies for
moratorium.
multitasking. Forgive me.
Dan, a lot of people were excited by that answer, but they're wondering about could eviction moratorium come under that authority?
Oh, I'm sorry.
As a safety precaution.
Forgive me.
Do you know the answer to that one?
As far as I know, it does not come under the health officer authority, the evictions.
Okay, so we'll note that so far we haven't seen that to be true.
Yeah, and we'll.
And that people are working to determine if it is. Shall we move to the next topic?
Yes, we absolutely can. Okay, so another big topic that's been top of mind for a lot of people is economic security for small businesses and gig workers. And you heard on the line that we have Heijin all the way from DC. So thank you for joining us, Heijin. Really appreciate it. And maybe you can speak to this a little bit after I do a quick overview. But from our local county sweep, we have San Francisco, San Mateo, and Santa Clara all looking at business stabilization, financial assistance, things like deferring restaurant taxes and licensing fees. I know a lot of Canadian partners as well are thinking about loans that are no interest or interest-free loans to small businesses as well. And small business majority, who I spoke to a couple of days ago in the region, is really paving the way to support these workers. They have a pretty robust policy and strategic framework, and that's in our resources slide towards the end of this presentation that you can look at. But they're working closely with the governor's office and the employment development department as well to look at lending programs for funders, connecting workers to resources and immediate cash assistance. They're doing a lot of really great work, and I think it's worth looking into their strategies, and it's worth connecting with them if anyone's interested in that. As far as statewide efforts go, there's a lot of disparate moving pieces, but the Small Business Administration Disaster Assistance for California small businesses is a fund for the economically impacted businesses by COVID-19. There's also an interesting Assembly member letter by Lorena Gonzalez to EDD to provide unemployment insurance to gig workers that have been misclassified as independent contractors. This is a pretty big loophole in this entire effort where a lot of gig workers are falling through the cracks. because of their misclassification. And then we have LA County working on allocating funds for wage loss, small business loss, and actually not looking at loans. So looking at more sustainable ways to fund and support their small businesses. I'll let Hei-Jin weigh in here. If there's anything else, Hei-Jin, that you think is important to mention here or that would be helpful for our members and community partners to be aware of, or how they can help support.
Hey, Asma?
Yes.
Quick question from the chat. Marianne Moore asked, is small business definition inclusive of 501c3s?
That is a good question. I think Hei-Jin might know.
This is Heather Henry. We're also the host for the Small Business Development Center. It does not include nonprofits. It's private only.
Great. Thank you, Heather.
Thank you.
I'll add one more thing about this. So the small business disaster loans, every county in the Bay Area is eligible for that. The small business development centers are providing assistance to apply for those loans because they are pretty cumbersome. Each small business development for each county, you can just go onto their website and click apply now, and the business advisors are getting back to them within 24 hours on that. Also, as it relates to rapid response that workforce boards are doing, there's a lot of support for businesses that are shutting down doors as well.
Great, thank you.
Sorry to jump up there.
All right, thank you, Esma. So let me just, try to talk a little bit about gig workers. This is Hei-Jin from Center for Economic and Policy Research in DC. Just to put it out there, I'm not as well aware of the local and statewide efforts in California, but I can sort of speak from a broader perspective of what I know about these workers and the protections that are available right now. So federally, you're probably all aware of the emergency pay assistance that was passed on Wednesday, and it includes tax credit for the self-employed, so they can get tax credit at average daily self-employment income for the taxable year. So if you make, $10,000 a year, then you divide that by 260, and that's what you get for the tax credit. It can be problematic first because.
Hei-Jin, sorry to interrupt. People are saying they're having a hard time hearing you. Is there any way you could speak closer to the mic?
Oh, okay, sure. Let me try to. Okay, give me 1 second.
And everyone else, if you can mute your devices, please, that would be great. Thank you.
Is this a little better or no?
This is better.
Okay, is it, okay, can you hear me? Or is it, okay. Okay, let me try this again. Just let me know if it's not working. I can try to call in or something like that. So I was just in the middle of saying that, federally, there is the emergency pay sick leave that was passed on Wednesday, and it includes tax credit for the self-employed. So they can basically get tax credit at average daily self-employment income for the taxable year. So you take the average income for the past year and then divide it by 260. That can be problematic if they actually don't make that much income. And so, what does that mean for the net earnings? And then this is, and for a lot of these workers, they live by, daily paychecks or weekly paychecks. And so, having that much of a delay is it's very problematic for a lot of these workers. And so any of the policy prescriptions or, any of the issues that we are just, talking about, housing stability, family stability, income support, food assistance, they all, whenever there is some kind of bill or some kind of efforts to talk about these supports, they have to include self-employed workers, and we have to sort of think about ways to include them so that, just to make sure that they don't fall through the cracks. Some states like California and DC are extending the unemployment insurance benefits, and they are including self-employed. And so, it's just, I think, important for any sort of local assistance to include these workers. And I do want to make a point though that we often discuss gig workers, and so when we think about gig workers, they're often transportation workers, Uber, Lyft, or delivery services like DoorDash. But there are a lot of these. The more significant chunk of this workforce is actually composed of independent contractors and on-demand, sort of on-call workers. So if you think about like home health aides or even house cleaners, these are sort of lower wage jobs that people don't often discuss. But I think it's also really important to think about them. Sometimes, sorry, can you still hear me? Okay.
Yes, we can.
Is there someone talking?
Yeah, if everyone else can mute your phones, we kind of hear some background noise. Thank you.
Anna Lilia, I think it's your line.
Oh, great, thank you. So I was actually just hearing about some of these layoffs at Philly Airport. So hundreds of contract workers have been laid off, but they are workers employed by subcontractors of, let's say, American Airlines. So American Airlines subcontract a lot of their workforce to like Prime Flight Aviation or Prospect Airport Services. And these are sort of contract workers, but they're not self-employed because they are hired by these contract firms, right? So when layoffs happen, these are the first workers to go oftentimes, and they have trouble claiming unemployment insurance and all of that stuff. And so I think we're actually missing a big chunk of workers when we discuss gig employment or sort of small businesses. So I just wanted to put it out there that these are sort of the kinds of workers that we also have to think about. So I don't want to speak too long, but if anyone has questions, I can try to answer them.
Great, thank you. Hey, Jen, are you going to be here until 11? Could people ask you questions at 11?
Yes, sure.
Or 11 hour time, I should say.
Yes.
Okay, thank you.
I'll be here.
Thank you so much for that. And I see that Sasha joined the conversation. Can you hear me?
Yes, hi.
Hi, Sasha. How's it going?
Good, how are you?
Good, thank you. I'm hoping you can talk a little bit about what California Immigrant Policy Center is doing around CalEITC inclusions of ITINs and the Young Child Tax Credit, and how that pertains to the COVID-19 response. I know you have slides of your own. Feel free to share those or just talk freely, whatever makes sense to you.
Yeah, what I can do is if you give me just a moment, I can share my screen. Okay, can everyone see my screen?
Yes.
Great. Sorry, I won't be in the full mode, but hi everyone, thank you so much for having me. As Asma said, my name is Sasha Feldstein. I'm the Economic Justice Policy Manager at the California Immigrant Policy Center. And I am part of a coalition of over 40 organizations, anti-poverty organizations, immigrant rights organizations, faith leaders who have been calling on the governor and the legislator to include immigrant tax filers, all immigrant tax filers, in the California Earned Income Tax Credit and Young Child Tax Credit. We've been working on this campaign to include ITIN filers in the CalEITC for several years now. And now with COVID-19, we think that this campaign is more important now than ever. I assume most people know what the California Earned Income Tax Credit is. But just in case, I usually send people to this website, which you can click on. The California Earned Income Tax Credit is a refundable cashback tax credit that is meant to go for people who are working but still living in poverty. And we've been working to expand this to include everyone because it is one of the most effective anti-poverty programs. And it's based on the amount of income you've earned in the past year, as well as the number of children in your household. And families can get up to almost $4,000 if they have a child under 6. Each year, the CalEITC has been expanded in terms of the age eligibility, making sure that self-employed workers are eligible for this, But people who continue to be left out include immigrant tax filers who are working and filing their taxes with an individual taxpayer ID number instead of a social security number. There's a lot of research to show how powerful the CalEITC is. Most of the research has been done on the federal earned income tax credit, but it's been shown that the EITC lifts millions out of poverty and helps prevent homelessness, promotes work and education, improves child and maternal health, and boosts local economic growth and builds economic security, which is one of the best things to protect people in an economic crisis. This is getting cash to people quickly, and then people end up using that to meet their basic needs, which means that money is going back into local economies. And so that's why it's really important to do during a time of economic downturn. So unfortunately, as I mentioned, over 1 million people are not eligible simply because they file with an ITIN instead of a social security number. And in fact, if even one person files with an ITIN, the whole family is ineligible, including if that person has children who are US citizens. There's been a lot of research to show about what the impact of this exclusion has caused. So this is a chart from the California Budget and Policy Center to show just the income gap between people who are actually working and earning the same exact amount. But if one family files with an ITIN and the other files with a social security number, because of these exclusions in both the federal EITC and the California EITC, after taxes, there's about a $7,000 difference in take-home income. So we know that coronavirus already exacerbates inequalities that already exist. Like, this has been going on for several years now, and our communities are the most vulnerable in times of crisis. Many immigrant workers are not eligible for a lot of the support programs that are designed to help workers, like unemployment insurance, paid family leave, paid sick leave, and other programs. So we think that the CalEITC and including ITIN filers is a way to get money to families now to help stem this tide, and to also make sure that we're putting money back into local economies and protecting people against a recession. Like I said, we've been working on this campaign for several years now. We have a bill that is a 2-year bill, AB 1593, as well as a budget campaign. But now, because of COVID-19, we are actually calling on the governor to do this immediately and retroactively. As many of you might know, the tax filing deadline has been extended to July. So if this is something that the governor did now, people could start filing and claiming their CalEITC. People who've already filed can amend their returns if needed. And so we are asking the governor to do this now. You can follow us at CalImmigrant. We have lots of sample tweets, posts, resources. I posted fact sheets from the California Budget and Policy Center on this slide, which actually show the amount of money that would be going back to each legislative district if ITINs were to be included. Here are hashtags. There's also a link to send a letter to your representative. And we have a sign-on budget letter that we're hoping organizations can sign on to. And that organizations can also contact their local officials to help get them involved. With Terry Oli's amazing help, we actually got the mayors of the biggest 13 cities in the state, the big 13, to send a letter to the governor talking about ITIN inclusion. We are also planning a virtual day of action April 14th in Sacramento. That's a little bit TBD right now just because of legislative recess and budget hearings being postponed. But if people are interested in joining the coalition, we have a coalition listserv, bi-weekly calls, and we're really hoping to get as much support as possible to make sure ITINs are included in the CalEITC immediately. So I'll stop sharing and answer any questions.
Great, thank you so much, Sasha. Are you able to stay on the line until 11:05, 11:10-ish?
Sure.
Okay, because I think we'll take questions at the end so we can get through everything. But I'll put a plug in for Terry if you want to add anything to that or talk about the Economic Security Project and what you all are doing in relation to Sasha's work.
No, I think that's great. Thank you. I'm glad to hear from Sasha. If there are any other questions going forward, I think, one of the things that we're going to have a bigger conversation about going forward in the coalition is like, is there an opportunity now to expand even further? And I think that's something I'm sure everyone is thinking about right now, or what is the line between opportunity and, but also what is the budget landscape going to look like going forward? But I think right now thinking about urgent responses is the right thing. And I think with the extension of the tax thing, that could provide a huge opportunity for people.
Great, thank you so much, Terry. There's a very quick question in the chat, and I think it should be fairly easy to answer, so I'll just ask you, Sasha. Is the tax filing or tax paying deadline extended? Or both?
The tax filing deadline is what I was mentioning. So that's been extended to July 15th, 2020 for both state and federal taxes. But actually, people who are low income can get an automatic 6-month extension for filing their state taxes, which means they would have until October 15th, 2020.
Great, thank you so much.
Actually, that is something to mention just additionally for people that are working with people who might be filing the EITC generally, not related to the ITINs expansion, is that you can file for retroactively for EITC that you might be owed from previous years. So that's something that is effective right now. And so there may be people who didn't file for whatever reason in the past, but could think about doing that now.
Great. Thank you so much, Terry. Okay, I will attempt to share my slides again. Can everyone see my screen? I'm going to assume yes. Okay, great. Thank you, Sasha. And thank you, Terry, for that really valuable information. And again, we have everyone's contact information if anyone's interested in getting in touch. So the next area connected to what we just spoke about is early childhood and supports for early childhood efforts that are coming out of local efforts, statewide efforts, and federal efforts as well. San Francisco has been doing an incredible job at converting recreational and library spaces into emergency childcare spaces for pre-K for children pre-K to 5 years of age for low-income and frontline service workers. I did link their efforts in the slides so you all can follow their work, but it's been an incredible update on a local effort, we think. And again, if anyone else on the line who wasn't on our policy committee call has any updates from their counties on early childhood efforts, please chime in. And so for statewide efforts that we've highlighted, the Department of Education, Health and Human Services Agency issued some guidance to help schools prepare in light of COVID-19. There's a lot of concerns around families who really depend on school meals as a source of their food security. And so we'll touch on that a little bit later when we talk about food security as well. And then Sasha just mentioned and talked about the young child tax credit advocacy work that they're doing, and that feels pretty pertinent on the state level as well. Federally speaking, TC touched on this earlier, but the Families First Coronavirus Response Act that was just signed by the White House provides $500 million, in food assistance for low-income mothers with young children and pregnant women. And again, I'm attaching this information on these slides so you all can follow that as well. Does anyone else have anything to add from their own jurisdictions or perhaps your organizations that you're doing around early childhood in this response effort?
So,
I see Oscar is screening it up.
Oh, hi, this is Paige Tomlin from First 5 Alameda County, and we're the whole team of early childhood folks in the county who are trying to put together emergency childcare for essential workers. Really hoping that there's going to be some funding from the either the state or the federal government, just because we want to make sure that especially our hospital workers can continue to go to work and that we can try to provide quality childcare for them.
Excellent, thank you, Paige. Oscar, I see that you're on the line. Yeah, I was wondering if you had any updates on any early childhood efforts that you might be doing around the coronavirus response. Right
well,
now.
I do know that our Emergency Operations Center is working with local childcare providers to provide childcare for our essential healthcare workers. So I know that's something that's actively, that they're actively working on and are utilizing some of our early childhood education providers, including our Head Start, early Head Start facilities.
Great. And can you quickly introduce yourself to the group?
Yes, so I'm Oscar Chavez. I'm the Assistant Director for the Sonoma County Department of Human Services.
Great. Thank you so much, Oscar. Okay. And I mentioned this briefly in the overview, but there's been an emergent question around law enforcement and equity in law enforcement response. And if Tram is still with us on the line, maybe you can speak to this a little bit more, Tram. But there's been considerations around kind of how do we track arrests and fines in this time, in the time of shelter in place, and other considerations that are kind of coming out of this response effort. Tram, are you still with us to maybe talk a little bit to the group about this thinking? Okay.
Tram says that she can't, she has a bad connection. Andy, are you still on?
Got it.
I could speak to it very, very lightly. I know that it's just something that we've considered, you know, a few of us at the health department, as something that could be a problem. I do know that it's being brought up by other community groups, and but if anything has actually, I'm not actually sure if any arrests have been made or any fines have been issued, and I don't believe that there's a strong desire on anybody's part for that to happen, including the sheriff, from what I understand. But that's really all I can say to it. I don't know if Andy or Tram had any more information.
Okay, great. Thank you so much. And I know that Alameda is also putting together an equity response plan, and they have, I think this is one of their key issues that they're looking at. And so we can, with their permission, share this out to the group or connect you all with Tram and others working on this as well. And some adjacent areas that we were looking at as well is healthcare and frontline service response. And so out of San Francisco County, came a $5 million fund to expand janitorial services, including coming out with some hygiene and environment cleanliness standards for shelters in low-income locations, as well as providing protective gear for healthcare workers. And the second area that we noticed people are really talking about and lifting up is food security. And so, for example, out of Marin, the Food System Alliance offering food security for students and that are campaigning to keep farmers markets open during the outbreak. And I know that there's also an effort to reframe that farmers markets are actually essential businesses and need to remain open in these times, given that going to a farmer's market is within the guidelines of staying safe in these times, that they're open air markets, that you can stay 6 feet away from each other, et cetera. And similarly, the California Alliance of Farmers Markets also has looking at this issue as well. On the state level, the governor's executive order N2920 waives eligibility redeterminations for 90 days for anyone receiving CalFresh food assistance. That's kind of what's happening on the state level. And so do we still have Dan on the line with us from Contra Costa County?
Hi, I'm sorry. This is Dan. I had to get pulled out for another meeting. I apologize. Just back.
Great.
So you guys had asked that I talk a little bit about how we've been organizing our messaging.
Yes.
Here in Contra Costa related to COVID-19. And I think we've kind of recognized that we're fighting 4 major epidemics simultaneously. One is the epidemic of COVID-19. The other is the epidemic of misinformation. The third is the epidemic of fear. And the fourth is the epidemic of stigma. And so let me just kind of briefly walk through those 4 areas and what we're doing. Obviously, related to COVID-19, like every other local health department, we've been all hands on deck trying to keep our system partners abreast of new cases. We're looking at trying to do surveillance on total negatives. We're messaging obviously actively and almost every day with partners who are affected by COVID-19. By that I mean partners like the school system, first responders, just as an anecdote, it's interesting that first responders want names and addresses of all positive COVID-19 cases, and we're fighting off that request, but I would gather we're not alone in fielding requests like that. Everybody seems to want to know the name and address of their neighbor who has COVID-19. So that is some of the kinds of information we're having to protect, but it's extremely busy on this end in terms of fielding those kinds of requests, just as an example. The epidemic of misinformation, and so, you know, we're referring, well, let me back up a little bit. Back to COVID-19 in general. We've staffed 2 call centers, one here in public health with as many as 8 people, 2 to 3 of which are clinicians handling nothing but clinician-related calls, and the rest handling calls from a variety of community, public community members, politicians, et cetera, blah, blah, blah. And then we have recently staffed up a 55-person virtual call center to handle the huge surge in questions we had related to the health officer self-isolation order that went out several days ago across the Bay Area. Calls on that are starting to decline quite a bit, but that is kind of overall sort of part of our messaging package. Related to misinformation, we are trying to message to folks who call us, whether they're calling the health plan, whether they're calling their clinician, whether they're calling us in public health, to go to our website as a one-stop place to get good, accurate data and information from the CDC, from CDPH, and from our own health system. You know, I think we will continue to battle that in this era of social media, but we are consistently acknowledging that the one best place to get good, accurate information are these official public websites. Related to the epidemic of fear and stigma, those 2 things interestingly go right hand in glove. I think early on in the emergence of the epidemic in the United States, particularly here on the West Coast, we, and probably all of you, heard lots of stories about inappropriate sort of behavior related to persons who are Asian. And this hit home for me personally, as my wife is Asian, so she and her family also experienced this personally. We have tried to do a lot of messaging related to fear and stigma. We borrowed a communication toolkit from Seattle, King County, up in Washington State. They put a really nice toolkit related to stigma together, and we got their approval to simply rebrand it and use their great information. That's now posted on our website. We are reminding folks that fear is natural, but we have to figure out how to collectively as a community manage that. We do anticipate there will be a bit of increase in pandemonium with the gubernatorial order for self-isolation that was announced yesterday. We did see some, I won't call it fear and stigma, but we saw a lot of folks who tried to convince us that their business didn't fall into the isolation and quarantine order. So folks tend to get pretty upset with us, and so we've had to grow a pretty thick skin. But you know, that really isn't necessarily fear and stigma. It's just more of folks feeling that they ought to be excluded from the order. I will comment that my own impression on the stigma piece is that it's starting to settle down a little bit as the community kind of focuses their anxiety and fear both on how to protect their family in the wake of the gubernatorial announcement that here in the next 8 or so weeks, we're going to have something in the neighborhood of greater than 50% of Californians contract COVID-19 if we don't alter the trajectory. So I do think we are trying to be a little bit more thoughtful about messaging like that. We haven't gone out and tried to talk a lot about the mortality rate or the curve, so to speak, out of concern that it's going to fuel anxiety and fear. We are in the backdrop of that working with our behavioral health colleagues, however, to have them sort of step up their availability to help with groups and individuals that are feeling anxiety related to COVID-19. I don't know if that's a decent summary of what we've done or not, but I'll just pause there, and if anyone has questions, I'm happy to try to answer those.
That's perfect. Thank you, Dan. And I will say about that we're putting together kind of a media recommendations packet for everyone on the line today, and that will include the recommendations that's coming out of Contra Costa per Dan's presentation just now, and as well including some key messaging that we've been hearing from Public Health Awakened, as well as the Berkeley Media Studies Group. And we have a couple of people on the line there that we can connect you to. And thank you, Kathy, for sharing some resources on the chat group. For the sake of time, we will transition into Q&A. And since Dan is with us, if anyone wants to start with questions around messaging right now, and I apologize, I know we're a little bit over time, but we'll try to keep Q&A to maybe 10 minutes, if that's okay. Melanie and TC, let me know. But feel free to start asking questions, and we'll start taking questions about messaging right now.
Well, this is more of a health department question. Dan, so are you all actually, because we're getting a ton of calls as well about, do I have to comply? Is my business really not an essential business? And I know that, you know, what we've been told to tell people is definitely like, that's your call. We can't tell you whether it is or isn't. Read the order. Are you guys actually being more directive in Contra Costa?
A little bit more so. I mean, if the question comes into us, we'll try to tell them whether we feel their business fits the description of falling under the order versus being excluded. I think one of the interesting groups that have contacted us a lot are landscaping companies and individuals who do landscaping, and asking why they are included in the order and other building trades are not included. And so I think, you know, as we refresh our order on the go forward, I've asked our health officer team to think about that, particularly in light of the nature of the work that those individuals do and whether or not there's really a high risk environment for transmission as they do their work. So I think on the go forward, we're going to try to be a little more thoughtful and accommodating, but at the same time, we hear concerns about some businesses that, since you're putting the middle finger up to all of us in the Bay Area and saying, you know, heck with you guys, we're going to do what we want anyway. And you know, for example, I think that I've heard anecdotes from colleagues who still work in downtown San Francisco that, you know, they walk by the local McDonald's and it's full and packed of people sitting at desks or at tables. So, you know, I think that all of us probably have our own local story about those few businesses that, even though they may be excluded in the order, aren't behaving in the manner we would hope them to. You know, the idea here isn't that we're going to go out and enforce that, and we've had some conversations with local law enforcement about, we don't really want you out there policing this at this point in time. You know, if we can get the vast majority of people to honor and comply with the order, it is largely effective. I think if we have pockets of industry or individuals that seemingly don't want to comply, we'll have to think about how we get them there without using law enforcement to do that. And I mean, that would be the absolute sort of last stick that we'd want to pull out. I don't know if that answers your question, but yes, we are being directive.
Yeah, I think I'll call you offline.
Sure.
To talk more.
We do have a couple more questions around messaging that just came in the chat, so I'll go ahead and ask them. The first is from Tracy, and the question is anyone messaging about equity and need for prevention to create neighborhoods that protect low-income, vulnerable Californians? And Dan, if you can answer this one, I'll let you take it. If anyone else has an answer as well, please feel free to chime in.
Well, I mean, no, not to my knowledge specifically. I think that we're, at least from the public health end, as we do what many of you know is disease investigation, contact tracing, it's, the issues of income and ethnicity and other issues just are irrelevant completely. We do our work regardless. I do think that the closure of businesses is having a disproportionate impact on persons of color and low income communities. And I do think, and it's my hope that at the state and federal level, they provide some form of economic relief or stimulus to help sustain the economy, particularly for low-income wage earners. That particular issue is a little bit out of the hands of local public health, but we are cognizant of that, and we have been, at least, our offices have been in regular contact with our state and federal representatives, bringing issues like that forward. In fact, I just had a conversation with Congressman Thompson yesterday about some of that stuff, as an example.
Great, thank you.
I mean, speaking from another health department, I think that the reality is that as this is crisis management, I think we're all running, behind the train in most of our health departments with this. And so almost all the messaging has been exclusively around the disease management, the disease containment, the social distancing, all the, health preventative type things. I do hope, and at least I could speak that that's something I'm going to work towards in my own county, is that we move our messaging more towards addressing the social impacts that will be happening as a result of this, and not just the disease containment, disease management part.
Mm-hmm.
Yeah, and I think BARHII can support some of that work for the regional level.
Yeah, I will say we've been hearing from
additional.
Sorry, go ahead.
Oh, I was going to ask if there were additional questions, or if I could ask a slightly different one.
There is one more. There's one more in the chat,
Mm-hmm.
and it's related to Dan, what you were talking about, kind of the fear and stigma piece, but more specifically around ICE. So, are there any current local efforts to combat ICE activities? There are reports that ICE is increasing activity in local communities, taking advantage of shelter-in-place order to target folks in their homes. This I haven't heard of, but if anyone's heard about this or knows more, please chime in.
I'm not aware of that on this end.
And this was Marley who shared this. So Marley, if you can maybe share the resources that you have that discuss this, and we can look into it, that'd be great.
And so one of the things we hope to get, this is Melissa speaking from BARHII, from this part of the conversation is also hearing from you other priorities or things you heard here today that feel most essential. So in a few minutes, we're going to break into small groups to talk particularly in a few of the key priority impact areas. But if there's anything you want to raise to the full group now, we'd love to hear your thoughts and thinking about what's most essential in this time. Our goal is to put together a regional platform that can be shared in these content areas.
This is Terry Oli. I just wanted to kind of flag, because while I'm on this call, there's like so much happening at the federal level. And I just think that we'll know within the next week or so what kind of support and relief will be coming from the federal government. And, I think we can expect that it won't be as much as we need, but that I think will really shape the landscape of how we want to push for resources being used in California. That I just wanted to kind of share that out. And there's a lot happening today and over the weekend on federal policy.
Great, thank you, Terry.
Hi, this is Larissa with All in Alameda County. I will say that I did see a news report that City of Oakland and the mayor are looking to commit $2.5 million to support or be an emergency cash assistance fund. And Alameda County, myself and the Deputy Sheriff's Activities League are looking at shopping a proposal to do the same as well, particularly for the unincorporated areas. Still very early, but we're looking to see what we can mobilize at the county level to support and provide emergency cash assistance. In terms of a legislative platform, we have the Alameda County is sponsoring AB 3118, which is changing the definition of what medically supportive or nutritionally supportive food means within the Medi-Cal system for those who might identify or screen as food insecure or have a chronic disease for which nutrition type prescriptions such as eating healthier, being more physically active, could benefit in their health outcomes. Given the shift in the Assembly and the Senate, shutting down operations through mid-April, We don't know where this really stands, but this level of nutrition assistance and being able to have a food prescription or have prescribed CSA boxes could really benefit and support on top of what we're already doing with the emergency safety net food system.
This is Tracy. I want to make sure that the message of primary prevention and creating healthy places that keep people from needing healthcare in the first place isn't lost in this. So our immediate response to immediate needs is obviously critical and important. And I think that we can also have additional messages around prevention and investing in the capacity of local health departments and community organizations.
Thank you for that, Tracy. And I did want to put a plug here quickly for the mental health piece. We've been getting some comments in the chat, but we are looking into mental health impacts of COVID-19 on our most vulnerable populations, and we are planning, it'll be some sort of a webinar, but as a part two to this conversation. And so we'll be convening with some of our partners from the mental health field to talk about their efforts, and then how our local health departments and community members and partners can also be involved in those efforts as well.
This is Beth. I'm getting emails this morning from APA, the American Planning Association of California, that are really interested in connecting with the public health community to put on some educational workshops for planners to kind of make sure their response is addressing the public health lens. So I'll kind of get in touch with folks at BARHII to connect everyone to make sure we get planners on board with a health equity approach to COVID response.
That would be great. Thank you, Beth. Anyone else have any questions for the group before we transition into our small groups?
Sasha, I just have one more thing to offer, because I did hear about county emergency funding for people who've been left out. In addition to our CalEITC campaign, which I'm happy to answer more questions about offline and share fact sheets and resources. We've also been in conversation with worker centers, day labor centers, and other organizations who in previous years have set up undocu-funds in response to the wildfires, and are doing so again in response to COVID-19 to make sure that the people who are left out, a lot of the services are protected. So I would just encourage reaching out to some of those partners and coordinating and collaborating as much as possible.
Sasha, this is Oscar. Thank you for mentioning that. Our undocu-fund is active and is actually running out of funds. So we'll need to do some outreach locally to replenish that. But I'm happy to connect the group with our contact if you're interested to learn more about our undocu-fund.
Thank you, Oscar.
I wonder if you could attach information about the undocu-funds, or it sounds like they're regional or county-based maybe, if you could attach that information to these notes, because that would be a really great resource list to share broadly.
Yeah, if anyone has any resources related to any of these topics, feel free to send them to myself or Melissa, and we'll make sure that it gets to you all after this call.
That's really terrific. Thank you.
Great, thank you, Terry. Okay, I think this is a good place to pause. I appreciate everyone on the line today talking about this really important topic. I know it's been top of mind for a lot of us. And it's, I know personally it's been hard to manage kind of thinking about this at work and then thinking about it offline too, come 5 p.m. So I appreciate everyone's hard work. I know we're all coming together and putting our best thinking, and I'm very hopeful that this is going to be the best way forward for longer term impacts as well as right now. So I appreciate it, and I'll give the presentation or the talk back to Melanie and or TC to continue.